Name of disease of actual cause of death.
CVA and hypoglycemia.
Good evening to all. I'm Sajan V S from Panam, India. Today, I would like to introduce a new topic, for you all. It's not a new one, but it's an important topic basically in palliative care, subcutaneous infusion. As we all know, while we discussing about the routes of administration of medication, we know so many routes are there for our administration of medication. Parenteral and non-parenteral routes are there. In parenteral route, mainly we giving oral type of medicines, tablet form or any syrup form of medication. In non-parenteral route means mainly in our practice we mainly giving intravenous route and intramuscular route. That type of injections mainly we giving. But in palliative care, the important route of administration, if any patient need to get a medicine as an injection form means we will give the importance for the subcutaneous route for the injection and the infusion. So now we are going to discuss about the subcutaneous infusion, about the subcutaneous layer. Just simply I am showing the layers of the skin as like three layer. Simply I am telling dermis layer, second one subcutaneous layer, third one muscle layer. So here second most layer, subcutaneous layer is the our topic. To this layer we giving injection form of or infusion form of medication. Like that we giving mainly in our practice. So about the subcutaneous infusion only we are going to discuss. So subcutaneous infusion, another term for that hypodermoclysis. What do you mean by hypodermoclysis? It's another term. Just split the word hypodermoclysis into three. Hypo first part, dermo second part, clysis third part. Hypo means below the level of dermis layer. Already the picture shows second most layer is the subcutaneous. So below the level of dermis layer is the subcutaneous layer. So clysis means administration. So hypodermoclysis we can define as like administration of small volume of medicine like bolus type of injection or large volume of medications like infusions as like drip to the subcutaneous space is the subcutaneous infusion or the hypodermoclysis. So suppose any infusion as like drip form of infusion we giving in dehydrated case means mild to moderate level of dehydration patient means we can give the infusion by subcutaneously for the rehydrate the patient. So what are all the indications? Mainly last I told about the dehydration. If we see one patient with severe dehydration, dehydration level we can monitor as like or we can define as like mild, moderate, severe. Mild to moderate dehydration means we can give the infusion by subcutaneously for the purpose of the rehydration. But moderate to severe or severe dehydration means it's not possible because already the dehydrated case means that subcutaneous tissue also very much dehydrated state only. So the tissue absorption very much low in that moderate to severe type of dehydrated cases. So ideally we can give mild dehydration means for the rehydration we can give by subcutaneously. Then severe dysphagia, painful swallowing or any difficulty for the swallowing. If the patient is suffering and patient is unable to take the medication by orally or oral type of.
Sorry to interrupt. Is the slides visible to all? Can anyone please confirm? Yes. Priyama, it might be some network issue from your end. Please check it. Mr. Sajan, you can continue.
Okay. So this type of severe dysphagia, due to the dysphagia, if the patient is unable to take oral form of medication, or patient is unable to take food by orally, or can't able to drink some of at least sips of water, in that type of situations, for the dehydration, for the rehydration, or for the management, if any medicine we need to give the patient means also we can give by subcutaneously. Then in per day, in one day, within 24 hours, if we have on plan to give 3 liters of fluid or 6 pint of fluid, we need to give within one day or within 24 hours means we can give that fluid by subcutaneously. Then, already I told in palliative care, the importance of the subcutaneous route of administration is very, very high only. In first one, nausea and vomiting. If the patient is having severe nausea and vomiting due to the disease condition or the prognosis of the disease at any causes, if the patient is having nausea and vomiting means patient is unable to take food and medicine by orally. In some cases, cancerous condition related to the gastrointestinal system also, due to the intestinal obstruction, in some cases fecal matter also coming in vomitus. In such situation, patient can't able to take anything by orally. Some cases we also experience in our setup. So this subcutaneous route we can choose for giving the injection form of medicine. Then mouth, throat, and esophageal any lesion or ulcer in this area means also patient is unable to take by orally. Such situation also we can give the injections by subcutaneously. Then intestinal obstruction. Already I told gastrointestinal system related cancer condition at any time we can expect the intestinal obstruction. Due to the obstruction, if the patient suppose taking any medication or food item also, it will cause the vomiting or it cannot fulfill the need for the management of the symptom. So that situation also we can give the injection form by subcutaneously. Then unconscious patient. Don't judge the unconscious patient in ICU setting. I am telling in palliative care setting, if the patient is in EOL stage, for maintaining the quality of life or for managing the symptom, only any type of infusion or injection we need to give means also such type of end of life stage unconscious patient means we can give injections or infusions by subcutaneously. We can't give by orally. Then intractable symptoms means if the patient, while we seeing the patient is having severe pain, 10 by 10 pain or 9 by 10 pain, or patient is unable to give the score, but patient is crying with that much severe pain. Such situation, if we choosing any tap form of medication, pain medication means it not appropriate for that situation. So we need to give the injection form of medication for such situation to manage the symptom or manage the pain. Then we can move to the tap form of medications. One example also, if the patient is severely delirious or severely restless, patient is unable to sleep, family members also unable to sleep due to this much restlessness already suffering by the patient means, we can give the injection form of medication initially to settle the patient, to make calm the patient, then we can move to the tap form of medication. That's the intractable symptoms that are not well controlled by the oral methods. We can depend the subcutaneous route for giving the injection. Then in parenteral route, already I told oral route mainly we using. If oral route is not possible for giving medication means we can choose the rectal route. In parenteral route, we can give by the for giving the oral form, same oral form of medication we can give by rectally also. So in rectal route, if the patient is already having any piles history or any bleeding history or any cancerous condition related with the anal region or CA rectum, in such situations we cannot give that type of medicines by rectally. Or if the patient is not willing to take by rectally or due to any shyness or any privacy problem, such situations we cannot give by rectally. So we can give the injection form of medicine by subcutaneously. Then, which are all the sites we can give this subcutaneous type of injections or infusion? First one, upper chest or intercostal plane. This picture I am showing upper chest or intercostal plane, or in such, if we choosing this area for any patient, mainly the female patient, means be cautious. Don't involve the breast tissues because it will damage the tissues. So be careful while we choosing the upper chest region. Then upper arm outer aspect or lateral aspect of upper arm we can give. Then abdomen around the umbilicus we can give. Then outer thigh or lateral aspect of thigh, both thigh region we can give. Then upper back, upper quadrant of the buttocks region we can give. Then scapular region also we can give. But in our setting, mainly we choosing the upper arm and outer thigh, because while we giving the subcutaneous injection or infusion to the patient, after discharge, we can educate the family member or we can educate the caregiver to continue the injections if needed in their home setting, means by subcutaneously they can continue. So it's more easier for to educate them and practice by them. So upper arm and outer thigh, most of all, we will choose for giving the injection. If suppose that area is not possible for giving injection, means only we will choose other sites. Totally, these are all the sites we can give the injections by subcutaneously. Then, which are all the sites we cannot give the subcutaneous injections or infusion? First one, if the patient is already having the lymphedema. Lymphedema, I think most of you know. Example, if one female patient is suffering with the CA breast, means that side, right breast means right side of upper arm having the lymphedema. Lymph vessel already it's affected, lymph nodules are already affected, so that lymph will affect and cause the lymphedema. If that arm already having the lymphedema, means we cannot give the subcutaneous injection in that arm. Then already having any skin sites, already having any recently irradiated or recent wound developed in the skin area, means we cannot give. Then any bony prominence means also we have to avoid. In close proximity to the joint area means also we need to avoid. Then skin folds and inflammation, any inflammation or any cellulitis infection signs already the area having, means also we need to avoid the injection in that areas. Then if choosing the abdomen for giving the injection, means already the patient having any ascites or any pitting edema, means also we need to avoid that area because already they are having edema. So again we giving the infusion or injection, means poor absorption only will happen. So we need to avoid. Then already the site we have to choose there any tumor or any scar tissue, means also we need to avoid. These are all the areas we need to avoid for giving the subcutaneous injections. Then what are all the main type of medications we can give by subcutaneously? These are all the example I am just showing. Studies are going on, daily proving on drug we can give by subcutaneously also. Majority medicines in our setting subcutaneously by when we giving only, I just I am showing here. Injection morphine, injection haloperidol, then injection midazolam, injection metoclopramide or injection perinom, then buscopan or hyoscine butyl bromide and fentanyl. These are all the common medicines we can give by subcutaneously. Then these are all the type of medications we cannot give by subcutaneously because it will cause the tissue damage. So injection stemetil and injection diazepam, injection promazine or antibiotics, hypertonic type of solutions. These are all the type of example for the medication and infusions we cannot give by subcutaneously. If we give any infusions by subcutaneously means we can give only normal saline. 0.45 percentage to 0.9 percentage normal saline only we can give by subcutaneously. In some countries, they are practicing dextrose normal saline. DNS also they are practicing to give by subcutaneously, but in our setting and in my practice also, I am giving only the normal saline by subcutaneously. And injection form of medicines, I already listed here. These type of medicines also we continuing in subcutaneously. Antibiotics also we cannot give by subcutaneously. Poor absorption will be happen. So circulatory system is only needed for getting the effect of the antibiotic. So subcutaneously we can give the antibiotics. Then procedure, as like every procedure, we need to explain the procedure to the patient because in our in palliative care setting, if the patient is coming in first time means the patient and the family members they are all well known about the intravenous route or intramuscular route of injection. They are all well known, but subcutaneous route of injection and the infusion, continuous infusion are all a new knowledge for the patient and the family. So we need to explain about the procedure, why we are giving the importance, advantages, everything we need to explain to the patient. Then, as like every procedure, wash, hand washing, then assemble fluid and the tubing. Mainly selected fluid and the connection tubing, everything we need to set initially. Then we need to select the site, which site we going to inject. That site we need to select. Then clean the area by using antiseptic solution, soap swab. We need to clean the area as like a circular motion from center to outward only. Circular motion only we need to thoroughly clean the area. Then leave to dry for 2, 3, 4 seconds. We need to leave for dry. Then after that, after cleaning and after drying, don't again touch the prepared site again with our fingers or bare hands. Then mainly we using SV set, scan vein set or butterfly cannula. In video, I'm going to show about the procedure, everything. Mainly this type of SV set we are using for fixing in the subcutaneous space as like cannula. So we insert the needle. While inserting the needle, we will place the bevel. Bevel means tip of the needle on cross section like on area is there. That side is the bevel. Bevel region we will be facing up and into the subcutaneous already selected, cleaned, prepared area. We prick by using this needle 30 to 45 degree of angle. We will prick and insert and then we will secure. For securing, we will using the plaster. Mainly, we using a micropore only. Paper plaster we will use for fixing that SV set on the pricked selected area for securing. Then adjust the fluid drip also as per the prescription by the doctor. We will adjust the drip fluid right also. Then, while giving the subcutaneous injection or infusion, we need to maintain the volume and rate, or otherwise it will make painful for the patient. So, if we giving any bolus type of injection for the patient means we can give 1 ml per minute. That speed we need to maintain. Or any infusion means, or as like drip means 20 drops per minute. In 1 minute, only 1 ml or 20 drops or 20 drops only we can give. If one more or 2 ml or 3 ml bolus injection if we needed to give by subcutaneously means that much patience we need to maintain by that much or 3 ml means 3 minutes. 3 minutes or 2 ml means 2 minutes. In 1 minute, only 1 ml we can give or 20 drops we can give. If we choose in one site for giving the infusion means within 24 hours or within 1 hour, maximum 1.5 liter or 3 pint of fluid or 1500 ml of fluid we can give within 24 hours subcutaneously in one site. If we choosing another site, one more site means that again that site also we can give 1.5. That means total in two sites maximum 3 liter or 6 pint of fluid we can give by subcutaneously within 24 hour maximum. One again third site is not possible. Only the two sites. It's the maximum volume we can give. But in palliative care setting, this much fluid not at all needed. For maintaining the quality of life only, we suggesting to continue the this much infusions. So in palliative care setting, there is no need, maybe 3 liter maximum volume only I am telling within 24 hours. Then after the procedure, uh, after connecting the SV set, after connecting the infusion tubings, everything. After within 2 hours, don't cross 1 liter. Be ensure about that 1 liter within 2 hours. Don't cross that. Then document the infusion fluid about the fluid and in name and rate, everything we need to mention the medications are. Then after 1 hour of starting the infusion, we need to check the patient and the infusion. Mainly that already the SV set fixed area we need to examine any edema or any pain or any leakage is complaining is there or not. We need to check after 1 hour of starting of infusion. If necessary, in while giving the subcutaneous injection and infusion, that side a mild edema is a normal thing only because there is no involvement in the circulatory system. Tissue absorption only that happening there. So while we giving the injection or infusion on that area, that tissue in the tissue, the medicine will collect and it will absorb gradually. So a mild edema is normal only. After sometimes the edema is not subsiding or edema is increasing. If the patient is telling the pain on that area means we need to we can give a mild massage on that area and we can resolve. Otherwise, we need to change the site. Then, for the subcutaneous injection and subcutaneous infusion, some of the advantages also there. First one, it's a low cost. Already I told scan vein set or butterfly cannula, SV set only we using for giving the injection. So this SV set, just compare the SV set and the IV cannula. IV cannula means more than 85 or 105, 125 rupees is needed for the IV cannula. But SV set is comparatively very much cheaper than the IV cannula. That's one is the first advantages. Mainly, a poor patient in their home setting need to continue the subcutaneous type of injection and infusion means it's more helpful for the family. Then more comfortable than the IV administration, both the injecting person and the patient also. Means in IV administration means the patient that much conscious and that much careful about the IV cannula. So after putting the cannula, patient that much careful about the area for keeping that patency in the cannula site. And while injecting time, any clot formation in the line means it will make some more painful for the patient. So injecting time and managing and that handling also very much comfortable is the subcutaneous than the IV. Then IV administration causes the sometimes it will cause the pulmonary edema. Already I told the IV means intravenous route means directly involved into the circulatory system. So if any fluid overload, anything happen means it will cause the pulmonary edema and such type of complication. But in subcutaneous, there is no involvement in the circulatory system. From the tissue, the absorption is only happening. So if any complication is happening means also only will affect the that site only. So it's a less complication for the subcutaneous injection. Then simple insertion also. So just imagine while doing the IV cannulation time, that much painful steps we will doing while doing the IV cannulation time. We need after selecting the area, we need to we need to tie by a tourniquet with support our coworker on that area. That after pricking, if the patterns is not there, means we need to reinsert in another side. Again, this much painful procedure throughout, we will continue while doing the IV cannulation. But in subcutaneous insertion means there is no need for any assistance or no need for any supervision because the only choose the area, just hold the area after cleaning, after drying, just insert the needle. We need to keep the angle as like within 45-degree angle only we need to maintain. So a simple insertion for the subcutaneous insertion comparatively with the IV. It's a less supervision also needed. While doing the home care setting and home care time also, there is maybe one staff only. There is not at all getting any supervision by your coworker or by your any seniors. So IV cannulation is little bit if the patient that staff is having confidence only, having the confidence only by confidently they can do the IV cannulation. But in subcutaneous means there is a no need for any supervision and the help. Then this subcutaneous route of injection does not cause any thrombophlebitis as like happening in the IV cannulation. Then already I told there is no involvement in the circulatory system, so there is no chance for the septicemia or any systemic infection. There is no chance in the subcutaneous infusion. Then at any time we can stop and we can start by subcutaneously. If IV cannula means, if suppose example I am telling today morning we put on IV cannula and we given on bolus type of injection by IV, then maybe SOS type of medication, maybe next dose maybe we have to give it night time or next day. So while we re-injecting time, maybe the cannula will block due to the clot formation. But in subcutaneous means there is no involvement in the bloodstream, so there is no clot formation. So at any time we can start and stop to giving the injection by the subcutaneously while keeping the SV set on that area. Then, as every procedure, some disadvantages also there. First one, possible any irritation or inflammation at the infusion site. Already I told it will not cause any thrombophlebitis or any pulmonary edema as like happening in the IV cannulation. But if any inflammation or irritation is happening, also there is only on that site or that preferable that site only will affect the irritation and the inflammation. Then in some cases, if the tissue absorption is poor, means possibility for the leakage. That subcutaneous site may will cause the leakage. Then in some cases, the allergic reaction also will happen. In some patients that adhesiveness plaster, microbe or paper plaster is allergic to some person. It's very rare only. In such situation also, that will cause allergic reaction on that area. So these are all the main disadvantages. Then this one is the side effects and the complication. First one, already I told localized edema. Mild edema is normal only. If the edema is not at all subsiding or the edema is not at all resolving after something, only we need to address it's a over edema. So if not at all subsiding means we can resolved by a spontaneously a gentle massage on that area we can give, and we can solve the localized edema. Then any inflammation or cellulitis. Already I told, after selecting, after cleaning, and after leaving for drying, don't again touch with finger on that selected site, on that spot. So if any technique while we doing the insertion time, any poor technique we doing, means poor aseptic technique if we doing, means it will cause the inflammation or the cellulitis. So we need to be careful while doing the procedure. Then pain or discomfort at the insertion site. It's very rare only, but already I told the rate and volume we need to maintain while giving the injection or infusion time. So if the volume or the rate is increasing, means it will cause the pain. Within 1 minute, 1 ml or 20 drops we need to maintain. It will, maybe it will fast infusion is going, means it will cause the pain for the insertion site. So we need to check the rate and volume, and we can reset again, so we can resolve the problem. Then puncturing of the blood vessel during the insertion. While the insertion time, if we maintain the degree within 45 degree of angle while we inserting, means we can avoid the puncturing of the blood vessel. But in some cases, while keeping the SV set on that area, with the SV set, patient can walk and patient can do any activity. If the patient can, means they can do. So while transferring from one place to another place, or while walking time, accidentally that area is hitting some door side or any corner side, means may will prick the small blood vessel by the needle end already fixed in that area. That rare only may will cause any blood bleeding. Bleeding means just blood tinged fluid only we can see in the tubing of the SV cell. If such situation we facing, means we need to remove. We can't continue the subcutaneous infusion in that area. We need to remove, and we need to resite. We need to select another site for the insertion and continuing of the infusion or injection. Then hematoma around the insertion site. This is also very rare, but in some cases, if the patient is already having low platelet level, or patient is getting any anticoagulant therapy or medication already patient is taking, means it will cause the hematoma around the insertion site. So we need to address about that. Then infusion device occlusion, means it's also very rare. If any connected tubing in between the tubing connection have any kingling is there, external tubing, any kingling is there, means we need to reset that. Then we can resolve the problem. These are all the main complication or side effects we can face while we giving the subcutaneous injection and the infusions. Then, as a nurse, what are all the nurse's responsibilities? First one, already I told, after keeping the subcutaneous needle on that area, or after starting the infusion, or after giving the infusion, every 4th hourly we need to inspect the area. And these are all the things we need to address while we inspecting the area once in 4th hourly. First one, if there is any tenderness or hardness on the injectable site, means it's having or not, we need to inspect, and we need to address about that. Then any hematoma formation is there or not, we need to check. Then any leakage, or already I told, if the patient that tissue absorption is very much poor, means it will cause the overload of the fluid on that area, and it will cause the leakage in the insertion site. So we need to check that any leakage is there or not, we need to check. Then any local tissue irritation, any redness or any warmth or pain or any inflammation sign is there or not, we need to check. Then erythema formation, already I told, any redness. Then any presence of blood or blood tinged fluid in the connection tubing is there or not, we need to check. Then any displacement of the cannula. If the cannula is displaced. Already displaced means we don't reinsert, we need to change the site. We need to choose another site for the insertion, reinsertion, and the continuation of the infusion or injection by subcutaneously. Then on equipment, about the equipment only I am telling. Syringe driver. Syringe driver means in our setting, as like a syringe pump only or infusion pump. This one is a simple, a small device. This one is the syringe driver. In our setting, this syringe driver is mainly we using for giving any medication, if any needed to give any medication for continuous infusion for 24-hour or a 12-hour, like that in continuous infusion. If anything we need to give, means we will use the syringe driver. Syringe driver is a small portable type of a machine. Its function is same as like infusion pump or syringe pump, but setting is very much simple than infusion pump. It's a battery driver infusion pump only. It both intravenously and both subcutaneously we can connect this syringe driver for giving the continuous infusion. Maximum 24-hour continuous subcutaneous or continuous intravenous infusion we can give by using this syringe driver. Syringe driver actually two type of is there: per hour setting syringe driver and per 24-hour setting syringe driver. This syringe driver main advantages from 1 hour to maximum 24-hour we can give infusion by using the syringe driver. In 24-hour syringe driver means that syringe driver minimum 24-hour to maximum 24, 48 hour, 72 hour, like that we can set in the syringe driver. So just I just introduced about the syringe driver only for infusion, continuous subcutaneous or continuous intravenous infusion. In our setting, we practicing this syringe driver in as infusion form, as like drip form also. We will give the any for the rehydration. We can give the normal saline as like infusions by the subcutaneously. Any injection form of medication, anything needed to give subcutaneously for continuous for that much hour means only we will use the syringe driver. So in this syringe driver only 10 ml syringe only we can use for loading and reloading and placing the injection for giving the infusion. But in syringe pump or infusion pump means we can use 20 or 50 ml syringe, ml of syringe, but in this syringe driver only 10 ml syringe only we can give for giving the infusion. Then
Nothing.
Now we can see on subcutaneous infusion that procedure video. We can just see and we can discuss.
Subcutaneous infusion of fluids or hypodermoclysis. Mr. Mahesh has advanced cancer of pancreas.
Good morning.
Okay. Already you seen the video. From the video, some points I need to add. While connecting the infusion setting tubing to the butterfly cannula or SV set, while connecting time and while removing time, we need to just pinch the entry point of the subcu needle because we need to ensure there is no entering of air in the tubing. If we initially any bolus type of injection or any infusion we giving means also infusion means already you seen the video before pricking we need to fill the chamber, fill the tubing also. Yes, we tubing also we need to fill. Then we need to make air free in the inside the tubing. Then only we will prick the subcutaneous site and we will fix. In bolus injection time also we need to fill the tubing with the medicine. Then only we need to prick on that area and continue the injection. Or otherwise the entering of the air in the subcutaneous space means also will cause the irritation on that area. Then as like IV cannulation, here also we need to place, we need to just label the date and the time. Why? Any idea from your side how many days we can maintain on subcu site? That for butterfly cannula, how many days we can maintain? Any idea? Kindly answer in chat box. Okay. In subcutaneous injection or infusion, we can maintain the butterfly cannula on that area maximum 7 days. 5 to 7 days we can maintain, but every 4 hourly we need to check the area. Any redness or any complications we in our inspecting time we assessing means also we need to change the site. So maximum 5 to 7 days we can maintain, but in between any complication we in our assessment we see means we need to change the site. Then already I told the advantages of the subcutaneous infusion and the injection. Just as a conclusion basis, I am again repeating. In palliative care setting, mainly majority of the patients in their curative side already they spend so much time and so many days in their other hospital setting for getting the medications by intravenously or other type of medications. Lot of medications already they took. At last, if they are coming in palliative care, again we continuing the intravenous type of medication means in their last days, if the patient have the wish to be in their home, last days they need to spend their days in the home means intravenous route of medication, again we continue means we cannot send that person to the home. So we need to consider about the patient and the family. In their wish also we need to consider. So we can fulfill the need of the patient and the family to be there in their own home by continuing the subcutaneous type of injection, because we can educate. Minimum knowledge only needed for maintaining or for giving this type of subcutaneous type of injection or infusion. So we can send them to home with this type of subcutaneous type of injection or infusion. Then low cost only. Financial burden already the patient and family having means also the subcutaneous type of injection and infusion means comparatively very much cheaper than the intravenous. So that financial crisis patient and family also we can help, and we can manage the symptom also for that patient. These are all the main importance for in palliative care setting, importance of the subcutaneous injection and the subcutaneous infusions. Okay, any doubts you are having means you can now share in the chat box.
If you are having any queries or questions, you can unmute yourself and ask. If you can put it in the chat box. Unfortunately, we don't have a case presentation today. We haven't received any cases of subcutaneous infection.
Procedure or about the advantages or any disadvantages, anything, any doubts you are having means now you can ask. Sony G. Question is if any hardness, how will you manage? If we assessing time, if the hardness we feeling means that time only we will stop the infusion or stop the injection to continuously giving in that area. We will choose another site and we will make free that area for the complete absorption. So after the hardness, if any signs of inflammation sign, anything is there means we will do by placing normal saline soaked gauze we can place on that area. In between, we can wet by using the normal saline soaked gauze. Isn't it painful? Leela Gandhi ma'am, it's a needle by pricking only we giving the injection, so it will cause a minute pain but comparatively distress free than IV. So already I told the rate and volume how we need to maintain. If not at all maintaining that rate or volume means it will make more painful for the patient. We can't do anything. So by patience, we need to maintain the rate and the volume. Then it will not cause any pain for the patient. If the patient is complaining pain means also we need to address and we need to change the site. The poor tissue absorption is an evidence for that. Again. Sansan, do you use sub-Q injection with patient who is having? Mainly, I already told in palliative care setting, palliative care patients, mainly we suggesting the subcutaneous type of injection and infusion. In our setting, majority of the medicines, if it possible and if it possible for the patient means also we will continue the subcutaneous type of injection for the patients. Condition basis. If any IV route of medication already the patient needed means we can't give by subcutaneously. We need to go to the intravenous route only. In absorption also little bit slower than the IV. Example I am telling. If we giving injection morphine trial, anybody know about the injection morphine trial? For the pain management, we will doing the injection morphine trial. Any idea? Example I am telling. If we giving the injection morphine trial means in between 10 minutes only we giving the injection morphine on dose in IV route. But in subcutaneous route means it will we need to take 15 minutes. 5 more minutes need to take for the absorption and getting the relief for the patient. As like every medicine, there is some lag is there up for the absorption and the action by the medicine. Madam, it's applicable if the family member or nearby any neighborhood already having any health professional is there means they can continue the IV injection or IV insertion. It's possible, but just consider low financial background or illiterate group of people, or there is no supporting system by a neighborhood or a relative from the relative side, any health professional means they are all very much helpless. In such situation, we can educate. Already I told minimal knowledge only needed for that person for giving the subcutaneous injection or infusion. So it's a community basis. It's easier than the IV. Anything else? Okay, thank you to all.
Okay, thank you everyone. Thank you, Sajan bro, for your wonderful presentation.